My pleasure to introduce Dr. Josh Rocker.
Thank you very much. So I just want to echo the words that you just said. I really want to show appreciation to the SAR leadership, to the Medical Advisory Board, also all the other individuals who have been helping, receiving the phone calls, dictating the phone calls so that we could review them, and a lot of people who are just doing little acts of kindness everywhere. It is enormously helpful, and thank you. I also want to give appreciation to the medical leadership, sort of in all the hospitals in our community, and to the people who are working in the hospitals, the doctors and nurses, the environmental staff who's cleaning up constantly. And then also I want to give a shout out to the mental health workers who right now are getting some calls, but the longer this lasts, the more important it will be for them to be looped into what's going on. So the message I want to give over today is a little bit about the seriousness of what's going on. I think, and I've mentioned this before potentially, is the emotional response and the intellectual response of reading the paper and seeing what's going on in our community. I think the intellectual response is trying to calculate things, trying to estimate how bad it's going to be, looking at the numbers, but the numbers don't really, I think, make as much of an emotional impact on us. I can tell you, as someone who has been planning for this for the last month, what I've seen in the last few days has had a dramatic emotional impact on me. Seeing the changes in the hospital, seeing the increased number at a very rapid rate, exactly as we predicted, but it just feels completely different when it actually is happening at you, I mean, in front of you and at your space. Many epidemiologists, the governor, have mentioned that they believe that anywhere between 50 to 80% of the population are going to get infected with this virus. That does not mean that everyone is going to be significantly sick. We know that around 80% of the people have very mild illness or are asymptomatic. So it's important to know that when we start, and I'm sure at this point, everyone probably knows it's a 1 degree of separation or 2 degrees of separation of knowing someone who has been infected. That is going to increase significantly over the next few days to weeks to up to a month. We will all have intimate contacts with people who are sick, who are having symptoms, or who are hospitalized. And it's scary. Talking to people, as I did this week, who are in the hospital on oxygen, and these are young people, older people. They're questioning lots of things, and they're scared. All of them recovered well, but it is a very significant emotional time right now. I want to talk about the seriousness of this situation and the seriousness of what, again, people have been talking, the flattening of the curve. That is a non-trivial issue. And we are seeing firsthand what's going on in the hospitals. So I work at Cohen Children's Medical Center, which is on the Queens-Long Island border. It is attached to Long Island Jewish Hospital. And so ironically, the PEDS ER is quiet. PEDS emergency departments across the city, across the region are quiet. For a few reasons. Influenza and RSV, the typical viruses we see now, aren't spreading because kids are staying away from each other. And we're not seeing the typical sports injuries that we usually see because kids aren't playing sports. We're still seeing some lacerations because kids are bumping into things in the house. But it is relatively quiet, and people are fearful to come to the hospital. And yes, we are diagnosing several cases of corona a day, but the kids aren't sick. We're having very, very, very few admissions for coronavirus. The story is, it's like black and white on the adult side. On the adult side, we're having very significant number of admissions to the hospital for people who are sick with coronavirus. And looking at the trends, people have looked at Italy and have compared us to Italy, and we are following trends very much like Italy. We know that Italy instituted very strict quarantining around 2.5 weeks ago, And potentially we're seeing some effects from that now. And as I had mentioned in the past, by instituting those strict regulations about interactions, we won't see that effect for 2 to 3 weeks. And potentially we are seeing that now with Italy. We need a few more days to really determine that. But that's my message of the day. Now is the time, right? It already looks as if it is growing very, very significantly. And if that happens, it will be frightful for the hospitals. Frightful for a few reasons. Well, number one is the number of patients coming in is very significant. I'm not so concerned about, because people are saying we're not going to have ventilators, we're not going to say, that right now. No, I think we will be able to support things. But as the families come in, as the patients come in who are sick, the doctors also start getting infected as well. And so as volume goes up of people who are sick, the people taking care of them goes down. And then you have other people who are substituting in. That's not a great situation for anyone. So we have to take this very, very seriously. And so when people say, well, I'm practicing social distancing, but I break the rules a little bit here and there, please. The risk, the risk to you may be small. The risk to the health system is very large. If we could spread this illness out over the next several weeks, to months versus having large spikes right now, it will make a huge difference for the burden on the healthcare system. Actually, at this mind, did we find Gita?
Yes, doctor, we're ready.
Okay, so I wanted to give the camera over to Dr. Gita Lisker, who is a pulmonologist and intensive care doctor. She is in the trenches. She knows better than anyone else right now what is going on. I just want her to speak a little bit of it. Go ahead.
Okay, hi, can you hear me?
Yep.
Okay, hi everybody. Not here to scare people, but I'm mostly here to be very realistic. So I am one of, like Josh said, I'm one of the pulmonary and critical care doctors at North Shore and LIJ. Arguably, probably one of the most prepared institutions at this moment. I was on call this weekend. I'm on every day. I cannot stress to you everything that you're hearing about how serious this is, because people are asking me, is it as serious as they say they are? Is the media overblowing it? To which my answer was, I don't even have time to watch the media. It is more serious than anything that we honestly imagined in our imaginations. It's unprecedented. I mean, I've been doing this, 16 years. I have colleagues that have been doing this for 40. There has never been anything in the history of our lives that has come close to this. I may be called to see a pulmonary consult, and I don't even have time to see the patient because they're just getting intubated and put on a ventilator. Now, obviously, this is not everybody, and I just want to remind everybody that, but our ICUs are overflowing. Each hospital has already opened up 3 full ICUs. We're going to a 4th. We have over 100 ICU patients alone just between North Shore and LIJ. That does not include the rest of our hospital systems. Patients are rapidly decompensating. The ones who are sick, I mean, not the ones who are in the hospital, many of them are rapidly decompensating and just getting intubated and putting on ventilators in such rapid succession that sometimes we just can't even keep up. This is the most serious thing that I can tell you. These patients are staying ventilated for a long time. We're pulling out literally every trick that we have in our book, obviously sedating them, medically paralyzing them, proning them, which literally means flipping the bed upside down, putting them on ECMO, which is oxygenating your blood outside of your body. We have clinical trials for drugs that were approved to start a clinical trial in less than 4 days, which is something that never happens. It's only gone through that quickly because of the risk of this emergency. We have people we are using, and if anybody listened to the president's press conference about an hour and a half ago, we are using the hydroxychloroquine, we are using the Zithromax. You may have heard him say they are by absolutely no means wonder drugs. People are getting, the ones who are decompensating very quickly and staying sick for a very long time. Yes, there are many that are older. That is definitely a risk factor. That's always a risk factor for any virus. But anyone on this chat who thinks that you're immune because you're 40 or 50, again, it's not the case. We definitely see risk factors in people in their 40s, 50s, and 60s with very common medical problems. People that You don't think of yourself as having a medical condition. So people with high blood pressure, people with diabetes, people who are overweight, and I don't mean morbidly, I just mean, people who are somewhat overweight with high blood pressure, with diabetes, with coronary, artery disease. These are the most common conditions. These seem to be risk factors for people who are getting hospitalized and getting into the ICU, and this applies to many people. Obviously, people who are on immunosuppressive drugs, are at risk. We have 2 pregnant women in our ICUs, so do not think that just because you're 25 and you're pregnant, you are immune to this. You are not. I mean, thank God they are doing very well. And we do have 1 or 2 actually in their 20s or 30s with no medical history. Again, is this the rare case? Yes, but it is out there, and I'm just telling you this, that if anyone thinks that what Josh just said, or what everybody is bombarding you with about staying put and staying home, and don't think that you're above the rule, if you think it doesn't apply to you, you're wrong. I will tell you, we are not Italy, we are not China. We have enough vents. We have right now almost 600 ventilators on backup in the Northwell Health System. We're not going to run out of ventilators. We're opening up beds wherever we can. We have a very robust healthcare system. Like Josh said, the healthcare workers are going to drop as more of us get exposed, and then we'll go out for some time, and then, yeah, you'll have substitutes until we get better, and then you bring us back in. But the main thing to slow all of this down is to slow the amount that are happening at once. So Pesach is coming. I saw there were a lot of questions. Can I go? Just no. The answer is no. It's very hard. Don't forget, there's no visitors right now in the hospital. You know how hard that is? I have a 95-year-old fully with it man who's probably going to die, but right now he's awake and alert, and his family cannot come see him. We have no visitors allowed. It's hard for the patients. It's trying times for everybody. Stay with your immediate family on Pesach and don't get together. If there's an extraordinary circumstance, that should be done on a case-by-case basis, but it's a slippery slope when you start to say, oh, well, I'm going to quarantine for 14 days and they're going to quarantine and then we're going to get together, and just don't do it. I cannot stress the severity of the situation enough. We're going to be okay. We're going to have the equipment. Like I said, our healthcare system is great. But this applies to every single person on this call. And if you're a kid, don't be stupid. That's all I have to say.
Thank you, Gita. Thank you, Dr. Lisker. So, I mean, what she is saying is concerning, is scary, is frightening. I sent out a text to the medical group for SAR and saying, guys, I plan on going out tonight and being a little bit strict and a little bit harsh. I want to make sure I have all of your consent with that. And these are the responses I got. Absolutely agree. It's now or never. Yet be strict. Agree. Couldn't agree more. These are the people who are working in the hospitals, and they are saying what they're feeling and what they're seeing. So again, everyone is doing calculations in their mind. What is the risk of me really going to the store? What is the risk of me? And the risks are all small. All of them are small, but small for everyone making the same decision to be mildly lenient, ultimately for the hospital means a big risk. So it is hard. It is challenging. It is hard for all of us to have to stay in the home. There are lots of very funny, videos from Israel about what it's like to stay in the home. And I encourage everyone to watch those. But it is the most important thing right now. Now, another thing that people may be thinking is, listen, if I get it now, at least I'm immune and I'll be fine for the next 3, 4, 5, 6 weeks. And their answer is, you're right, but the hospitals can't handle it right now. So it's not, again, only about you. The decision-making is all about the public health right now. And the burden on the hospitals is very significant. Whether, so period. There are a number of questions that people sent beforehand, and I want to address a number of them. Any questions that have to do, that are detailed medical questions, I'm not going to cover. I'm not going to talk about medications. Gita mentioned the risk factors that we talked about. One of the things that people are asking are, what are the symptoms? We all heard about the fever and the cough, and that seems to not totally be, the only things, and that's true. We know that, fever is can be a later finding. You may initially start off with a sore throat, a little bit of a cough. We're also seeing GI symptoms such as vomiting or diarrhea. But again, still most of the symptoms are going to be, having to do with a cough. Could you have a runny nose? I think in the beginning we were like, oh, you have a runny nose. No, you could. So the symptoms could be almost anything. There has been more chatter about people who are losing certain senses, such as taste and smell. That has definitely been mentioned by patients who have it as well. Tends to be more in the younger than in the older, not in the children, but like 20, 30, 40-year-olds. And we're definitely seeing it there. And usually what happens is you get it, you don't feel well, and then it's 5 to 7 days. You may have a day where you feel a little bit better, but generally at around day 7 to 10, and the fevers last for a long time. Generally at around day 7 to 10 is where, if it's going to happen, decompensation occurs. And what we talk about in regards to people having difficulty breathing, the questions we ask, because it's, if the distance that you walk, to the kitchen, if you're walking upstairs and you're noticing that you're having a hard time breathing during that time, that's a critical time period to get doctors involved. To speak to your doctor. If it's really significant at that point, just get to the hospital. Before we mentioned, maybe contact the doctors beforehand, say that, you'll be coming in, you're, potential risk for COVID. At this point, every single medical institution is prepared to receive someone who is potentially COVID positive. Again, just there's a lot of fear, and I don't want people to leave this with absolute anxiety, but I do want people to leave this with a significant amount of concern. Many people get this, and their symptoms, abate after a while, and then they feel fine. So just be aware of that. If you get a fever right now, if it was 3 weeks ago, 4 weeks ago, I think when we initially had these conversations, the risk of having flu was still fairly high. We have seen the flu numbers drop very quickly. And in pediatrics, we've also seen other viruses that kids frequently get. Those are still present, but not nearly as high as they were a few weeks ago. So, at this point, if you have fever, especially it's for several days, with my body aches, sore throat, the odds of you having coronavirus are very high. And the question that people are asking is, but I can't get a test. If I can't get a test, how do I know? At this point, we're saying, assume yes. Assume that you have it. And it's not going to change your management in regards to how you're going to take care of yourself, but it will change the way you behave within your home. So if you are having symptoms that are consistent with coronavirus, the fever, the body aches, headache, sore throat, cough, I would at that point isolate yourself within your home. And what I would do now, if you don't have those symptoms, think about and plan what it means to isolate yourself in your home. Plan it out with your family. What would we do? How would we eat? Where would we go to the bathroom? Who's going to do this with the kids? I visit my grandmother. Who's going to do that? So, I do all those planning things now, because when you're sick and you're sort of in a little bit of the crisis mode and you have the emotions of, oh my gosh, this could be serious. That's not a time where you're going to be thinking the most clearly. So do the planning now. A question that some people have asked is, well, if everyone is positive in the house, how should we handle that? If everyone's positive in the house, then it's fine. Then you don't have to isolate yourselves all individually. You can be together obviously I wouldn't be sharing cups and everything like that, but you all have it, and that's fine. People are asking, when is life going to get back to normal? And the answer is, we're not sure. Right? There have been various predictions that have said that we are going to peak in May. Some have said in June, and some have said that this is going to go way on into August. These are all mathematical models, and it all depends on quarantining, how well it's done, and various other factors. So we're not exactly sure, but a lot of things that people are saying is, prepare for the marathon, not for the little race. This is going to last a while. Yes, think about the next mile. This is what marathon runners do. They think about each mile. So think about what you're going to do for the week, how you're going to accomplish everything that week, but anticipate many, many, many weeks of this. I expect, people to have more sort of social isolation insofar as seeing physically other people. Get used to that because this is going to be here for a while. Pesach. The answer is no. I'm sorry. No matter what variation you want to say that it's okay, the answer is generally no. Pesach should be with people in your home. And unfortunately, gathering with other people will just increase the risks. Additionally, in Pesach, which is around 3 weeks away, we are going to be 3 weeks deeper into this, and it is going to be much more within the community and spreading. I think we also may have had a bias where SAR community was hit fairly significantly early on, and there may be in some a false sense of like, hey, it came and I'm okay, so it's not so bad. That's because few individuals had it, and thus they were only able to spread it to few individuals. If it comes back around, to our communities, which it certainly will, it will not be a few individuals. It will be many, many, many individuals, and the risk will be much higher, and the rapid rate of transmission will be much higher. So that's something to be aware of. Having to catch or having play with other people, guys, I'm telling you right now, and I apologize, I don't want to be sort of the harbinger of this news. I would refrain from all of these interactions for the next 2 to 3 weeks. We have to get a grip on this. If we don't, it's going to be a major problem. If I'm positive, when can I return to just normal social distancing? Now that's different for healthcare workers and other workers. And there's been, initially the CDC said that you had to be tested negative twice, 1 day apart to make sure that you're fine. The data on shedding, some people have said 3 days after symptoms end, but that's symptoms end all except cough. So if you still have fever, if you still have body aches, if you still have sore throat, that's still considered a symptom. A cough, we know sometimes coughs can be a little bit residual even after viruses really have completely ended. So we're saying, again, some people say, some data has talked about 3 days after symptoms completely stopping. Then some people are talking about 7 days, and some people are talking about 14 days. So there's no great right answer to this. Obviously, if we had a rapid test that could be easily done, that would really help us. We do know that some people could shed for up to 3 weeks after the symptoms are over. So we want to minimize the exposure to other people. So I would, after a week, I think it's probably safe to sort of, still be within the home. I would not go out, at this point. Is walking safe? Getting outside is important. There are so many aspects of this illness right now that is, and I'm talking about the medical, aspects, but there's the mental health aspects of things. And if you only stay in your home, and if you're only on a screen, you are going to go bonkers. So I think it is extremely important to get outside. Now the issue is when you're outside, we all live in different communities. Some of us live in the city, some of us live in the suburbs, some of us live a little bit more distant. Try not to interact with people. We talk about the 6-foot rule. That's great. Extend it to a 10-foot rule. Be that guy who's being like, you know what, we'll talk a little bit later, not now. Really keep a distance. So that's about going outside and walking. Very healthy, vitamin D, sunshine, it will change your mood. It is important. Am I immune after I get it? And the data sounds pretty convincing that you probably are. It's not 1000%, but that's generally what we think. So the question is, can I then get it again within the same season? Generally, we think no. In regards, if there's a mutation like there is with flu, could this come back next year? Potentially. And if it comes back, we have no clue what it's going to look like. It may come back and affect one person. It may come back, be equally as vicious, or it may come back and be very, very mild, or it may not come back at all. People ask about elevators. I live in an apartment. Should I take elevators? it doesn't matter what you take, just don't touch things, right? If you take the stairs and your hands are on the railing, it's just as if you were taking the elevator and pressing the buttons. Use a shinui, use something to press the buttons, or as you're getting into the elevator. Use an umbrella, use something else. Don't use your hands. And that goes for doorknobs, common spaces. People are like, oh, I'm getting together, but we're 6 distance apart and we're sitting in the common space of the lobby. Okay, but who sat in that chair before you? How long ago were they there? Do you know where they sick? Were they not sick? You don't know. So, and we can go crazy over all of the, potentials. Wash your hands constantly and really try to minimize any touching to the face. I think all of us are experiencing this reality where we realize, oh, we just touched our face. And when you realize that you probably touched it 4 other times before you realized it. So just try to focus on not doing it, but even best, wash your hands, wash your hands, wash your hands. Soap and water, and if you have any disinfectant, that's great as well. Limited testing. So people are asking, like, there's limited testing, that's horrible, I'm not gonna know. Or should I be tested? The Department of Health came out with a recommendation on Friday. This is the New York City Department of Health, saying we no longer recommend anyone testing unless they are a hospitalized patient, right? So the reason for that is a fewfold. One, by you going, so at testing centers, the rate of positivity is around 40%, right? So if you go, the odds of you being positive are around 40%, just because that's, the group of people that are there. So you put healthcare workers at risk. You put everyone that you came in contact with as you, went out to go to, this center to get tested at risk. And what did you learn? You learned something which you kind of already knew based upon your symptoms. So you're putting healthcare workers at risk. Those healthcare workers have to use the term is PPE, personal protective equipment, which is the mask, the goggles, the gloves and everything, which they shouldn't be using. They shouldn't be doing the test. That equipment should be available to the doctors in the hospital. And then another crazy thing is, a week or 2 ago, we were talking about testing and how it's limited because it's a slow test. We don't have everything. We can now do the test quickly. At our institution, Northwell, they could do 1,000 tests a day, but we're running out of swabs. Because we're running out of swabs, testing someone out on the street who isn't feeling that terrible is a waste versus testing someone who I know needs isolation or needs different care when they're in the hospital. So we are not recommending anyone get tested. And at this point, if you feel that you have symptoms, assume yourself to be positive. Pets. I don't know a tremendous amount about pets, but if you are walking on the street and other people are petting your dog, they are transmitting whatever they have on their hand to your dog. And I'm not concerned about the dog getting it and then the dog giving it to you. It's the germs on the dog that you are then going to snuggle up with, and then you are going to rub. So it's not like the dog is giving it to you as much as they're just the carrier. They're just the vector that's sending it to you. So try not to have other people pet your pet when you're out. I was told to give a plug to the Rockefeller study. Any study that people are doing at this point, either I know Jacobi is doing a study at Northwell, they're doing a study on medications. Rockefeller is doing a study in regards to serum samples, is extraordinarily helpful. So the Rockefeller study is those who are corona positive, contacting them and potentially getting some blood samples. Anytime that we can get more data will give us more information on how to treat this in the future. I think that's all I want to say. I want to focus also on mental health again. I mentioned it in the beginning, I mentioned in the middle, I want to mention again, finding practices for your day-to-day routine is going to be extremely important. Getting up in the morning and, if you want to have a practice of, whatever it is, exercise, going outside, with, significant distancing, or picking up a hobby. We have time, we're home, reading books, getting the things that you want to do. Very, very important for yourselves. And also still connecting to other people. Communicating via Zoom, communicating via your phones, very important. Reaching out to people who you don't think others are reaching out to, very important. And also, I want to end with something that happened in Israel. I don't remember what day, but at 6 p.m. a few days ago, It was sort of medical health, or not medical, it was healthcare workers appreciation. People just went outside and started clapping. So at 6 o'clock, I think that's good for the spirit. I think it certainly raised the spirit of the doctors and the nurses and other people working in the hospital. And I think it makes people feel good that they know that they're contributing to others as well. So that's all I'm going to say for right now. If there are other questions, you can certainly come back to me. But that's it. It's a serious note, but that's what it is. Thank you.
Thank you, Dr. Rocker, and thank you, Dr. Lisker, and thank you to the team of doctors who have been so incredibly helpful after very, very long days. We deeply appreciate it. Sorry, Josh, just it's lighting up. Just a question about touching mail, handling mail and packages and delivered food. Just a second about that.
So that's complicated. I mean, I'm not an expert on this. So whatever I say, someone could be like, oh no. So it's use some seichel, like people who are wearing gloves. Don't think like your mail carrier who's wearing gloves. That's nothing, right? They're not changing it, every so often and washing their hands. Gloves are helpful for doctors so that we don't get what you have on you. But after I see you, I take my gloves and I throw them away and then I wash my hands. So I'm not at risk. Someone who wears gloves all day, it's just like having hands. Like it's no different. So by having gloves on, it's not like, oh, they have gloves, everything's fine. It's no different. So someone asked me the other day, someone was going to send them supplies from an area where they think people may have been contaminated. What should we do? I said, don't open it for a few days. We know that this virus can only last for so long on certain surfaces. So when it comes to, this may sound ridiculous, but when it comes to mail, maybe let it sit for, a day or two before you open it. That will certainly be the safest. Another thing is open it and then wash your hands immediately afterwards. So as long as you touch something, it's fine. People are like, I wear gloves in the grocery store. Great. And what do you do in your house when you take your groceries out of the bags? Are you wearing gloves then? How about when you take it out of the cabinet like 40 minutes later? So it's just wash your hands, wash your hands, wash your hands, wash your hands.
Got it. Thank you very much. Really appreciate it. And again, we will have more opportunities for you to share your questions and hopefully to get back to you in the different forums that we have available.